Hello there. Our topic for today is prehension. I am Dr Srishti Banerjee, Masters of Physiotherapy in Neurology. Prehension. Prehension in normal layman terms is just holding an object or grasping an object. Prehension activities involve grasping or holding an object between two surfaces of your hand. These two surfaces of your hand means the holding an object between your fingers and the palm. The thumb may participate in certain prehension activities and may not participate in other activities. Prehension is divided into two types: power grip, which requires your entire hand, a full hand prehension is required, and precision grip, which involves gripping only through finger and thumb. Now, these are the characteristics of both the grips. Power grip involves forceful flexion. There occurs a forceful flexion at all the finger joints, and thumb, after grasping the object, acts as a stabilizer to hold the object between your fingers and the thumb. Precision handling. Precision handling is comparatively skillful. It is a fine movement of holding small objects between your fingers, between two fingers, or between a finger and the thumb. In precision handling, the palm is not at all involved. Phases. The phases of power grip is opening the hand, then positioning the fingers along the object, bringing the fingers to the object. Once the fingers are along the object, the thumb plays a stabilizing role and the object is held. In precision handling, there is opening of the hand, there is positioning of the fingers, like for example, holding a key is a type of precision handling, right? Then there is, in power grip, there is some movement allowed at the proximal joint. For example, some movement is allowed at the wrist joint, whereas in precision handling, specifically only the fingers and the thumb manipulate the object. Power grip, the thumb is adducted. In precision grip, the thumb is abducted. Now, we will be seeing different type of power grip. Different type of power grip are cylindrical grip, spherical grip, hook grip, and lateral prehension. First is cylindrical grip. Simple. Cylindrical grip is like holding a water bottle or a can or a doorknob. This generally involves all the flexors muscles, specifically flexor digitorum profundus, interossei acting primarily at the metacarpophalangeal joint, flexor pollicis longus, and the thenar muscles. The hypothenar muscles will flex and abduct the MCP joint, and typically the wrist is in neutral or slight ulnar deviation. The second type of grip is spherical grip. It is more or less similar to the cylindrical grip. The only difference is there is a greater spread of the finger. For example, holding a ball, and the most important muscles here are the interosseous muscles. The interosseous muscles are primarily involved in this type of spherical grip. Hook grip. Hook grip is specifically like simple. It is like this: a grip which forms a hook. As you can see, it forms a hook here. The major activity of flexor digitorum profundus and flexor digitorum superficialis. The thumb is in moderate to full extension. The simple example is carrying a briefcase. Lateral prehension. In lateral prehension, as you can see in the diagram, there is a contact between two fingers. Metacarpophalangeal and interphalangeal joints are in extension. Metacarpophalangeal joint can simultaneously abduct and adduct, and the major muscles here are the extensor musculature. For example, holding a paper. This was all about precision. This was all about power handling. Now we move on to precision handling. Precision handling requires fine motor control, and the sensory system should be intact. In two jaw chuck, you can see this is two jaw chuck. One jaw is the thumb, okay, which is abducted and rotated, and the second jaw is by the distal. See, this is how a two jaw chuck grip is formed, right? There are three types of precision handling: pad to pad. See, this is pad to pad. You can see the pad, the pulp of both the fingers. Tip, this is tip to tip, okay, and this is pad to side. In pad to pad grip, the pulp of both the fingers are in contact with each other. The MCP and PIP joint of the fingers are partly flexed. The distal interphalangeal joint is slightly extended. It is extended or slightly flexed. The thumb in the thumb, the CMC joint is in flexion, abduction, and rotation. Metacarpophalangeal joint and IP joint are partially flexed or extended. Example here is holding a forceps. Now, tip to tip. The muscle activity is almost same to pad prehension, just the tips are in contact. The metacarpophalangeal joint of the opposing finger is slightly in the ulnar deviation. For example, holding a pen. This is a typical example of tip to tip prehension. Now, lastly, side to side prehension. In this side, as you can see, the lateral surface, it is a lateral pinch grip, as if you are pinching someone, right? It is a lateral pinch grip between the thumb and the index finger. The thumb is adducted, more often adducted and less often rotated to form a fine precision handling. Okay, this was all about prehension. Thank you.